What's more efficient for you? How can I be more convenient to do? By the way, we have this opportunity to do things remotely. We can download the app right now, take your first pictures, and we can get going. That in itself, offering it to a patient, has changed his whole dynamic of how often he's closing business.
Hello, everyone, and welcome to another episode of the Raving Patients Podcast, sponsored by Cloud Dentistry. As everybody knows, my name is Dr. Len Tao, and I am excited to have another newer company on the podcast to introduce you to what they do and how they do it. The aligner space, or let's say the orthodontic space, is an ever-growing market. Tons and tons of patients are coming into our offices every single day looking to change the way their smile looks, and they're looking to clear aligners specifically for that reason. So today's topic is called Embracing Digital Communication with Your Patients Without Disrupting Your Practice Flow, and we're going to be talking about a product that's called AlignFlow. So please welcome to the Raving Patients Podcast, Kurt Hoffman and Matthew Quinn. Thanks, guys, for joining me today.
Thank you.
Thank you.
So for those that don't know, who you are, why don't you take a moment, introduce yourself, both Kurt and Matt. Why don't you introduce yourself? And then we'll briefly let the listeners and viewers know what exactly your product does before we get into the other parts of the podcast. So Kurt, why don't you take it away? Why don't you introduce yourself? And why don't you introduce, because you're on the clinical side, why don't you introduce what AlignFlow is? And then we'll have Matt introduce himself.
Sure. Thank you so much for having us. I appreciate being here. My name is Kurt Hoffman. I'm an orthodontist in the Kansas City metro area, and I graduated from UMKC Dental School in 1994, and I've been treating patients with fixed appliances since then, and Invisalign since it became available in 2000. We developed a product to monitor patients remotely as they're getting their orthodontic treatment. It's a software package, and it works great. Matt?
So just to be clear, the product is a similar product to dental monitoring, where it monitors the patients remotely so they don't have to spend their time in the dental office. That's really what it does. In a very small nutshell, we'll get more involved with it. But just to break it down as a little like elevator speech, that your product is a competitor of dental marketing. You're going to remotely monitor patients, so it limits how often they get into the office.
I think that's a good summary.
Yeah, that's a fair assessment.
I wanted to make sure people understood what that was. So, Matt, why don't you tell the listeners and viewers about yourself?
Yes, my name is Matt Quinn. I'm the Chief Revenue Officer of the company, and I work pretty closely with manufacturers, distributors, but primarily with dental practices. I focus on educating the practices how to migrate from having patients coming in to their practice to being able to communicate with them remotely through our app. And so what we really talk to practices about is workflow and how can you maximize profitability by communicating with patients through their phones. And it's been very, very successful. Patients love it, and the practices love it because it frees up a lot of chair time, and it gives them the ability to focus on aspects of the practice that they may not be able to because they're so dang busy.
Gotcha. Okay, great. So let's talk about some of the things we wanted to get to. So obviously the direct-to-consumer model in clear aligners exists. It's a growing market. Obviously there are some better players than not, and I'm not here to judge anybody. In my practice, we are an Invisalign provider. We just started doing some Sure Smile recently. Actually, the new owner did. But we are not using the direct-to-consumer model, but it's a very big thing in the industry where, patients are coming in and they're getting work done or getting aligners done through these direct-to-consumer models. So talk about how you fit in there. How do you compete with them? What is your space in the industry? Let's start with that.
We're trying to bring the patients back to the dentist because that's who we think should be treating patients. And with the success of direct-to-consumer aligner treatment, we have noticed there's a market there, there's a demand there, and people want that type of treatment, but we feel they should be monitored and followed by a dentist before, during, and after treatment. And that's where our application comes in. It allows us to treat patients how they want to be treated.
Now, as you mentioned, and I misspoke off air, it is a product that can be used for, it's not just limited to clear aligners. It's something that can be used for anything fixed or removable. So any type of orthodontics you can use this product for.
That's correct. It's best suited for treatment methods like aligners that you can plan the treatment out digitally and then put the process in motion and check it as it goes along. And oftentimes, if you've got a good treatment plan and a good patient, they can complete the series of aligners before they head back to the office. But you're right, it does work with products like Brius, which are fixed appliances, a lingual appliance where you put in the framework and you don't need to remove it for 5 to 8 months. So as long as it's being monitored, that monitoring can be done at home and eliminate appointments for you and the patient while the movements that you've prescribed and directed are occurring.
Great. Okay. So also to clarify, you are able to work with any aligner company. So if they're doing something in the office or they're doing a direct to consumer model, you can still use this product to monitor the patients.
Absolutely.
Perfect.
Dr. Kyle, I think the critical component here is compliance. And what we've done is we've actually patented what we call treatment MPH. So it has patient engagement that they have to answer specific questions on top of uploading the picture. We calculate a compliance scorecard that quickly allows the practice to know who's being compliant, who is not. So that is a key component to this, is because from a time efficiency standpoint, the doctor does not have to waste their time with people that are above a score of 80. We have a scale of 1 to 100. Doctors are only focusing on people that are below 80, and that allows the staff to either reach out to them to do a live virtual call or say, hey, wait a minute, you're not following the prescription, you need to come in.
Gotcha. That definitely makes sense now. So thank you for clarifying that. So let's talk about, I think one of the biggest advantages of it is saving chair time by offering remote monitoring. So can you talk a little bit about how the product works and how it really is going to save chair time for the offices?
Yes, I've noticed that's one of the biggest benefits for me. Of course, it also saves patients time, which is what they want, and they appreciate that. But what I appreciate is the reduction in hours worked while increasing production. We're able to see an aligner patient for the initial consult, scan, explain treatment and cost. And then when they come back to the office for their second visit, we can deliver attachments, do our IPR, set them up on the app, and give them all of their aligners. And then they go home, and it's really not time consuming for either the doctor or the patient. All the patient does is take 3 pictures when they change aligners. One with the exhausted aligner in their mouth so I can see how that fits. One without any aligner in their mouth. And then a picture with the new aligner in so I can compare the differences and see the progress. Then, like Matt said, they also are randomly asked a question or two every day and record every day how many hours they're wearing aligners. And that data goes in and computes their MPH. And we're able to see how compliant they are, while we're also physically seeing how the teeth are moving and working. And if things are on track, they keep going. And if they're not, we call them into the office through the app with the messaging feature.
So I have one question. You mentioned something, and I just want to clarify. Is the dentist who the patient is seeing monitoring, or someone else is monitoring for them?
The dentist is doing the monitoring. So this is trying to replicate the current in-office, you're my dentist treatment that most patients desire. They just don't want to come in as often.
Gotcha. Okay. Now, that makes sense now. So basically the dentist is going to, does the dentist get a notification when the patient has uploaded their aligners to the system? Talk about that process just so people understand what happens.
That's correct. I'll get a few different types of messages on my phone. Some of them are just direct questions from patients like, hey, I lost my aligner at the parade, St. Patrick's Day parade or whatever. What do I do? And, oftentimes they've only got 4 or 5 days left. So we move them to the next aligner and update the tracking on the system. We can also get a message that says, Casey just changed her aligners. And so at my leisure, I can go look at those pictures, and then I can respond to that and say, good job, keep going, or use your chewies. It looks like a front tooth is not seating, or I think you need to come into the office for a refinement scan. So whatever, we just get a little note. It pops up like when you have a text, it has a red number on the icon on my phone. And that's how I know I've got several messages. And those are the different types of messages you can look at.
One thing I wanted to add to this too is that we have live virtual call capability built into the app as well. So it's not just strictly text, it's live virtual call. So Dr. Hoffman can actually request the live virtual call right to the patient's phone and vice versa. And either party can say, hey, I can't do it now, let's schedule something. So Dr. Hoffman can actually do a personal video, send a personal video to him, or say, hey, can you take a video side so I can see the molars in your mirror, upload that so he can look at video. It's a very robust communication platform.
And it's all HIPAA compliant too.
Gotcha. Okay. All right. So for somebody who's listening to this and wondering, okay, so I have a patient, I'm doing the aligners on them, or I'm doing Invisalign on them, let's say, they come on in. You're recommending that they do all IPR at the beginning so they don't have to come back again then?
Yes. We do have some patients where, some incisors are overlapped and I'm not going to be able to get good contour. And so we try and have, if we have to have an interim appointment to either add an attachment or do some IPR, we try and do that somewhere in the midway point, and that will add one appointment.
Gotcha. The reason I ask you that is because I was taught by David Gates on Invisalign. I don't know if you know David. David is an orthodontist in Las Vegas, and he always taught me, it's very hard to hack your way out of the jungle when all those teeth in the front are all overlapped. And that's why I was always taught to do posterior IPR rather than anterior IPR later in treatment. So that's why I was wondering how you recommend doing it. So you may have to bring the patient back for another IPR visit then.
Right. And that's the beauty of this. We're not trying to change the way doctors treat patients because, we're pretty good at it by now. We're trying to add a new tool to our toolbox so your office isn't losing remote patients, and you're not bringing in another one of the frustrations of aligner patients that I had, and the patients could even feel this frustration, is when they'd come in and everything was fine. And they were like, what did I come in for? And I'm like, well, because I only gave you 4 aligners and it's been 8 weeks. Here's 4 more, keep going. And they're like, well, am I going to have to miss work again? So you still need to bring them in for those in-office appointments. And those are value added. Those are the things that Smile Direct Club can't do that we do offer. And those are still important and still should be done. Just try and do them efficiently and group those types of things together to minimize in-office visits.
Well, you mentioned that, Invisalign, you started doing Invisalign in 2000. I started doing Invisalign in 2007. But what's interesting is that over those years, the aligner space has changed dramatically. There's a lot more players. The materials have changed. The physics we're applying to teeth have changed a little bit. So I think that in the past, 5, 6, 10 years ago, something like this, remote monitoring would be considered crazy because we were so concerned that the patients were tracking properly. And I think that they track so much easier if they just are compliant with treatment. So I think this makes a lot of sense for practices to limit the amount of time that someone's actually in the chair, thus decreasing the cost on top of the significant cost you're outlaying for an Invisalign case or one of these other companies. So I think that's the real beauty of a product like this.
I think you hit the nail on the head. And that's something that I've noticed over the years too with the improvements from aligner companies is it happens slowly. You used to need those in-office visits and you'd see them and there'd be some value to them. And suddenly I'm having all these patients come in and I'm having to make up some perceived value for them. And the appliances are so good that they're working.
Yeah. Hey, I wanted to jump in here on the front end of this process too, because, we're talking about the middle process and the end process. Kurt's a perfect example of this. Since 2019 to 2022, his treatment plan close rate has gone from 58% to 75%. And it's primarily because his office has gotten so good at having the conversation with the patient saying, what is your lifestyle like? What do you do? What's more efficient for you? How can I be more convenient to do? By the way, we have this opportunity to do things remotely. We can download the app right now, take your first pictures, and we can get going. That in itself, offering it to a patient, has changed his whole dynamic of how often he's closing business. I mean, Kurt, would you agree?
I would agree. It's helped that. And it's where our biggest growth and patients' parents have always been, once they see how the process is working, even before aligners and braces, a great number of them go, well, I could do this. This isn't that hard. That's happening at a much higher rate with aligner treatment when they see their children's teeth getting straight and doing it remotely. Adults hate appointments even more than kids do. And they're like, wow, you know what? Let's do this deal for me too. And I see a lot of that. So generation leads and also conversion. You're removing another obstacle for a certain portion of your patient population.
Well, I think it's very intriguing for a patient who comes in and they're going, look, some people come in once and they sign on the dotted line right then and there, but there are people who've gone to 5 and 6 different consults. And I always ask them, what's the holdup? Why aren't you making a decision? I think if you can tell them that, hey, you're going to come on in, we're going to do this, and it's going to limit the number of times you come in the office from, every month, every 6 weeks to literally, it could be twice or 3 times during the entire time. Put them on, do IPR, and then take them off. So I think that's a very intriguing aspect to something like this.
Yeah, it is. And there's so many cool features and things that happen with this product. This is a product unlike dental monitoring in many ways. A big thing is its pricing structure. Dental monitoring is going to cost you a lot more dollars per month. But secondly, it's designed by orthodontists and dentists for orthodontists and dentists. And 2 things that stand out to me that we built into the system, but I didn't know the value is, one is the messaging feature. It appears and feels very much like your text messaging feature on your phone, but they can text me or my virtual clinical assistant at any time, and we answer that within that, up until bedtime the same day or first thing the next morning. And once you send a text message to someone, which this feels like, it changes your perceived intimacy with that person. It's like you wouldn't send a stranger a text. You'd send them an email first or something like that. But once you get these texts back and forth, you're having these conversations that are so rich, like you have in your office. You're learning about them. They're telling you stuff about their kids or something that happened. And that is huge for building your practice. And then the second thing is the resources tab. There's a tab on there for resources, because after you've given their attachments, given their aligners, you can sit there and give oral instructions to them. And many patients have checked out and they're tired at this point. With the app, you can point to the resources tab and say, here's everything you need to know about your aligners. And then any assistant in any of my offices, I know my patients are going to get a consistent message on how to go through with their treatment, care for their aligners, and care for their teeth while they're in it, and have it on their app, on their phone, to access whenever they want. They're not going to lose a piece of paper and have to call the office on Monday for things like that. But those are 2 really cool features of the app that I didn't think they'd be as cool as they were.
So, Matt, anything you want to add there?
Yeah, I mean, the thing I like about the app is the person remains on the platform after they're done with their procedure. So that relationship does not end. I have a lot of practices that say to me, we really struggle with recall. We really struggle. We make calls, we send emails. This is a better way to communicate, in my opinion, because you now have real estate on their phone, and you can actually, like Kurt was saying, once they're done with the treatment plan, saying, you know what, we discussed that you have a problem with TMJ, or we had this, can you come back in? Let's talk about this. I want to try to resolve that as well. So from a recall perspective, it's huge because they're not going to delete you after they're done with the treatment plan, and they can communicate ongoing about, hey, your 6 months checkup's coming up, or whatever. And we've just found we didn't realize how big of an impact it would have on recall.
And I'd like to add something too for that. As an orthodontist, I don't do hygiene appointments, but what a lot of our dentists are doing, like you said, is they're piggybacking that IPR. And if you have to add an attachment on their recall appointment and using the app, not just to monitor their dental treatment, but this will send out messages for their 6-month recall appointments as well. And it's helped boost compliance with that too for patients.
So dental monitoring charges you actually buy a device and they charge per device. So the cost is considerably higher than I'm assuming something like this. I'm assuming that you're paying for a number of either users or number of patients that are within the platform. So can you talk about the revenue model on this type of thing for a practice?
Yes. I'd like to just say that dental monitoring charges per patient per month. And it's depending on volume, anywhere between $10 and $12. Plus, you need the box, which you have to inventory, and is $10 to $12. We don't have either of those prices. We charge each office low fee per month to like any software subscription. So it's a software subscription. Use the heck out of it, and you're not going to get overcharged. Why don't you talk more specifically, Matt, about that as our Chief Revenue Officer?
Sure. We got 3 tiers. One is 4 logins at a practice up to 100 active patients. And then it goes as high as 25 logins up to 700 active patients. So our monthly pricing ranges between $249 to $699. We actually can get a practice up and running in about an hour and a half from training session, which we charge a one-time fee for that of $699. We customize all the templates. We customize all the resources. We customize who has access to which, what we call care groups, because not like we were talking about before, not everybody's going to be aligners. They may be doing teeth whitening. They may be doing sleep apnea. So you can segment your database by care group as well, assign different people who are assigned to different patients. The really cool feature about this is that we kind of skirted around. A lot more as the GPs are getting into aligners, but they're fearful. They're like, hey, I don't know what's a good case, what's a bad case. I can set Kurt up in any practice as a third-party consultant to look at any ClinCheck with Invisalign or any other and give advice. So from a GP perspective, they don't have to outsource that. They keep it in their ecosystem with a third-party consultant helping them. Huge revenue boost for them.
Gotcha. That makes a lot of sense. How about tracking patient compliance? How is that? I mean, obviously, I don't know if the questions you're asking, because we were always taught, ask a patient specifically how many hours per day they're wearing the aligners. So they have to come up with a number. So I don't know how you're questioning them, or if you're questioning them within the app. How are you tracking that patient's actually wearing them enough time?
They are asked to report daily, and they get a little message, and they do have to input a number. So when the patient opens that message, it takes them to the app, and they move a slider bar from 0 to 24 hours. And we're asking them to report how long they've worn them in the previous 24 hours from this point. And that's pretty good. We have also started asking questions, and those have been randomized because we find we get better feedback if you change some days they don't have any questions. They just do hours. Sometimes they got 2 questions. Sometimes it's just something fun. And so they're more inclined to go open the app and, see what we're going to ask them and put their hours in. They can still lie to you. We also have a patent on it's a little big right now, but it's to monitor temperature. And we're trying to, we have it, as soon as they get down small enough, we can just make a reservoir in each one of the aligners. We can tell Invisalign, put this reservoir in each one of them, and then you clip this in. So someday we hope to have this totally automated and streamlined, so we'll know how many hours it's at 98.6. And then we don't have to ask them. So right now we are asking them a number, which is the best we've got right now. And soon it'll track it on its own.
Well, the interesting thing about this is that we've gamified the process. And if you open up your app and you see your score at 45, you inherently are embarrassed. And you're like, what the heck is going on? And then you start looking at, oh crap, I haven't answered anything for 4 or 5 days. So it's almost like self-fulfilling, because who wants to have a bad score? And who wants to get scolded by the practice saying, and the other thing too is that as a parent, and I went through this personally, is my daughter had to get a refinement and she's going to have to do something. I spent $5,000 and I'm mad that I wasn't part of the process and being able to monitor it. And if because a parent can actually see the same data as the practice. And if I'm going to spend $5-6 grand, I want to make sure that my child is being compliant. So it's kind of self-fulfilling, and it's interesting because people hate to have a bad score.
Yeah, that's a great point, Matt. We are putting parents on the app as well. So the parent has it on their phone and the child has it on its phone for many reasons. But from a treatment standpoint, we can get messages from mom and dad if they have questions. And mom and dad can read the instructions that we're giving to their child. And then they're also reinforcing compliance because they're like, hey, I saw you got a text from Dr. Hoffman. What's the deal? He says you need to, boost your hours. So yeah, parents are on that. They're watching it. Compliance is great. And it's not a lot of work. What we're asking patients to do is like 5 seconds every day. And it doesn't kill your score if you miss a day or two. Like Matt was saying, it'll come back up once you answer. And then you take 3 pictures at the aligner change interval. For most people, it's about 2 weeks. So it takes 5 minutes every 2 weeks, and it takes 5 seconds every day to be cruising above 80 and give me the data that I want to make sure I'm treating my patients well.
I'm curious, have you had any practices that have, because you talked about gamifying it, have you had any practices offer like for, special, rewards or anything for hitting certain scores or just maintaining compliance or something?
We are working on that. Like there's a really fun app that I try and, whenever I go travel, I try and learn some of the language. Duolingo, I think, is really fun and really good at gamification. And so we're working on that to where we're going to have, trophies and stars and, maybe see how you're tracking against the other patients in my office and get some of that going, because all that builds and boosts compliance, and just compliance for using the app, which translates with this app to actual dental compliance.
Gotcha. So I want to shift a little bit in the time we have left. Let's talk about, I know that there's no cost to the patient. We know that patients, it's a free app you download. The practice is paying for it. One of the questions I have as I'm thinking about it is, do you white label the product to make it specifically from the office?
That is a great question. Yes, we do. And so they're getting more every time they get a message or open their home screen. They're going to see your logo on the app. So when they go to the app store, they're going to look for your logo, Hoffman Orthodontics. And so it's like you have an app, and that's pretty cool too. Just have an app in the app store. Patients go, whoa, you have your own app? I sure do.
The interesting thing about this too, and this is the world I come from. I come from digital and print advertising and marketing before this. You can put a QR code in any of your printed material as well as your digital material. And when they select that QR code, so the person is going to see register or I'm a patient. If somebody registers, that means they're on your platform and you've never even met them before. And you can actually start communicating with them. So it has a lead generation component in it as well. It's not just who my current patients are. It's like, who are my potential patients as well?
I'm a big fan of the potential of bringing other patients in. So I think it's great. I think it sounds really cool. As we move to the end of the podcast, do you want to talk about ways that the listeners can save a little bit of money on the subscription?
Yeah, we'll offer a special discount on our subscription rate of 20%. We have no contracts. It's very easy to get up and running. We do a demonstration for the practice, which takes about 20 to 30 minutes. And then we set up a follow-up onboarding call, which takes about an hour and a half, and you're up and running. We follow up every 2 weeks to say, hey, how things are going. We watch how many active patients are on there. We give them tips and ideas how to increase that number. And, it's a very simple process.
Do you want them to use a code? Do you want them to use something to let them know that you heard about them on the Raving Patients podcast?
just let them know they can go on AlignFlow.com and they can hit a demo button and just put in the message, heard this on the Raving podcast, or they can call me directly at 913-827-1603. So you can go right to the website to set up a demo, and we'll reach out and we'll get it going.
Okay. Before I do our close, is there anything else that you wanted to make sure that you got across to the listeners and viewers? So any final thoughts, Kurt or Matt?
I'd just like to say it's super easy to set patients up on this app. When a patient comes in and they're doing their starting appointment, I just have to put in 3 items: their first name, their last name, and their email. A fourth thing I need to do is select what type of treatment they're doing, a liner treatment, and you push a button and it populates everything across the platform on my app and on their app, and it's functional and running. So this isn't going to be a big time addition. It's going to save you so much time and appointments, and it's not going to make the way that you treat patients now and start aligner patients take any longer.
Matt, any final thoughts from you?
Yeah, I mean, being a finance guy, I always look at the numbers and the impact. I mean, Kurt has taken his practice from being open from 38 hours a week to 31, and he's doubled his revenue. And he's moved his whole base of customers from about 50% aligners up to about 80% aligners, Kurt? Is that accurate?
Probably for starts, but I'm still finishing up. So I'm probably in the 50-50 range for my practice right currently. As those people get their braces off and we do more aligners and digital treatment, it'll get higher.
Yeah.
But that is, for me, I'm not a numbers guy. I'm a peace of mind guy. And the pressure on me and on my staff has lowered, so we're happier. Our office is a happier place, and I think that drives people into our office too, because people can smell that stress when they walk in, and we don't have it anymore because our day-to-day is less packed and our weeks are more open. Yet we're seeing more patients and we're spending less time producing more money.
Gotcha. Well, this was very enlightening. I definitely see the need in the industry, and I think it's a definite money saver for practice, especially by offering a significant decrease in the chair time needed to normally do these types of cases. So, Matt and Kurt, thank you so much for joining me today. Hey guys, if you like this podcast, please share it. Please let your colleagues know. If you want to learn more about the product, please check out their website. It's AlignFlow.com, correct, Matt?
Correct.
AlignFlow.com. And schedule a demo to learn more about their product. We are releasing these episodes now Fridays at 5 a.m. If you need to get a hold of me, simply go to the Raving Patients Podcast.com or drlentau.com. And always remember that your reputation matters. Thanks very much for this episode, and we'll talk to you guys soon.
Thank you, Len.
Thank you.